And thanks so much for choosing us. The Asokwa District Court has been told of the cruel manner in which social activist Ibrahim Mohammed, also known as Kaka Macho, was brutally assaulted, leading to his eventual death at a Jura in the Ashanti region. Ibrahim Mohammed died 3 days after the attack. Briefing the court, Chief Superintendent Kofi Blagoji, the Ashanti Regional Judicial Police Officer, said Kaka's assailants, armed with dangerous implements, first attacked his occipital region till he became unconscious at about 1:30 a.m. on June 26, 2021. Ohim Interior of our security desk was in court and has filed this report.
According to Chief Superintendent Kofi Blagoji, Kaka was returning home on his motorbike when the accused persons, Fuseni Alasa, a butcher, Ibrahim Isaka, also known as Enyas, and Idi Mohammed, also known as Chuboros, ticket seller and blacksmith respectively, attacked him whilst entering the house. Even when he became unconscious, the accused persons did not stop but continued beating him. The accused persons left him in that unconscious state and absconded. Kaka was later sent to the Ejura Government Hospital but was referred to the Konvanoche Teaching Hospital, where he was on admission until his death on June 28, 2021 at 1:40 a.m. The accused persons have since been charged for conspiracy to commit crime and murder contrary to Section 46 of the Criminal Offences Act 29 of 1960. Prosecution, led by Chief Superintendent Blagoji, pleaded with the court to remand the accused persons into police custody to enable the police do thorough investigations. The court, presided by Her Worship Akuya Edubuahin, remanded the accused to reappear on July 22, 2021. From Kumasi, for Joy News, Ohim Interior reporting.
We'll be continuing shortly with developments on the Jura deaths, but now Ghana has recorded its first community infection of the more transmissible Delta variant of the SARS-CoV-2 virus. The case is an indication the variant, which was detected in travelers who arrived at the Kotoka International Airport some months ago, has now found its way into the community. The number of COVID-19 cases in Ghana has declined considerably in the last few months, but the discovery of the new variant in the community has the potential to cause a spike in cases. In the latest update on Ghana's COVID-19 cases, June 26, there were 85 new cases and 1,674 active cases. The death toll stood at 796. Now, joining us via Zoom is Director General of the Ghana Health Service, Dr. Patrick Kuma-Boaje. Thank you very much, Doc, for your time. Doc, what are the details of this discovery? Kindly unmute for me, you. Doc.
Yeah, thank you very much. As we mentioned, since January, we've been doing sequencing through a part of our surveillance. And so cases picked up at the airport, we do sequencing. We also started community-based sequencing. At the last report we had discussed, I mentioned that, yes, we have discovered 6 variants of the Delta variants at the airport from travelers. However, we hadn't identified anyone yet in the community, even though we had the other variants, Alpha, etc. Last night, as part of the routine surveillance, we're informed that Noguchi had picked up some Delta variants, and we are currently investigating and also looking at the other extent as to whether is it just an isolated cluster or it's more generalized. And that's why we have in the statement that was issued by the Ministry of Information that by Sunday we'll give a full briefing as we have to put in all the other data to see where exactly are we, and whilst we also try to work towards any further containment and prepare for it.
Look, when was this variant detected, and what are the implications for the spread in the community?
Yeah, I mean, the report came in late last night. And that indication is that, yes, this is a variant that spreads faster than usual. And so we need to ensure that our protocols are adhered. I mean, the protocols work for all, whether it's Delta, Kappa, or Alpha, or whatever we have. But we need to ensure that we are protected. We are wearing our mask. We may not have had enough people vaccinated, but at least you still have the option of wearing your mask, using a social distancing effectively, ensuring that there's no mass gathering as minimized as much as possible, then also improving our ventilation. I think these principles still hold, irrespective of the kind of variant we are dealing with.
But when did this person test positive? Do we know?
We are still investigating. I mean, this is just a very fresh. I mean, as you know, this is just very, very important news that we need to ensure that we put it out there. Further investigations will be made to see where are the samples coming from, whom were they checking, is the person positive, where is which community were they living in, so as we continue to respond.
Doc, what advice are you giving to the public? I mean, now that we've found the variant in our communities.
Yes, to show that these things are going to be regular occurrences, and as long as the disease is there, we may be coming up with other variants. But the most important thing is people must protect themselves. We must wear our mask in public. We must do the social distancing. Schools, everybody must abide by the protocol that have been prescribed. And that's worked for many, and that's worked for many countries. And I think once we adhere to it, irrespective of whether you've had a case or even if you are fully vaccinated, it's still important that you protect yourself, because so far no vaccine gives you 100% protection. So and if you're picking it, you may give it to somebody who may not be protected.
So as it stands now, we don't know which community this was found.
Well, I'm sure by Sunday we'll be able to look at it. Currently, we don't have a generalized outbreak, even though you've seen the active cases go up slightly. There are sporadic outbreaks. I mean, there are clusters of outbreaks that you have, say, like maybe a mine may have a lot of cases because of poor adherence to protocols. You may have a facility, a workplace. That's what we are having. And currently, we are looking at all that to see that which clusters are these coming from. This is just from the routine, and then we'll be able to give you full details on Sunday.
Doc, before you go, would you advise tighter restrictions on public gatherings?
Well, I think the restrictions are there. The most important is adherence to the restrictions that currently exist. I mean, if we wear our mask, if we avoid mass gathering, if we all do social distancing, irrespective of where you are, I think I will still be protected. But I think we'll continue studying the system. If you see a certain pattern that means that there's some further restrictions need to come in, we will provide the necessary advice for the authority to take that decision.
I'm grateful for your time. Director General of the Ghana Health Service, Dr. Patrick Kumabuaji, there. We're still live on Joy News Prime.